Hello student, we have started discussing some case scenarios from surgery, from GIT surgery, from hepatobiliary system, and we have discussed some case scenarios of the gallbladder. Now, today we are going to discuss another case scenario, and the case scenario is that a 50-year-old female have done laparoscopic cholecystectomy 15 days back. Now she present with jaundice. What are the possible causes of jaundice? How will you investigate and treat this patient? And what complication after cholecystectomy she can develop? This is a history of a very old lady who had already done cholecystectomy, but even after cholecystectomy she has jaundice. So what are the possible causes of jaundice? The gallbladder has been removed. The stone has been removed from the gallbladder. The whole gallbladder along with stone is removed. Again, the patient is presenting with jaundice. So the possible causes are ligated CBD instead of cystic duct. Stone remain in the CBD and strictures and adhesion in the during the surgery when the doctor ligate the cystic duct, he sometimes mistaken the common bile duct as the cystic duct and ligate the common bile duct instead of the cystic duct, due to which obstructive jaundice occur. Sometimes the doctor remove the gallbladder but does not explode the CBD, due to which stone occur. The doctors sometimes remove the gallbladder, but some stones remain there in the common bile duct, due to which obstructive jaundice after surgery occur. As well as after surgery, adhesions and stricture can form at the site of wound, and these adhesions and stricture can obstruct the common bile duct and can lead to obstructive jaundice. What are the investigation? First of all, we will do ultrasound. Ultrasound will show us the stone in the common bile duct as well as dilatation of the distal bile duct due to dilatation of the proximal bile duct due to stone. ERCP, in ERCP we pass an endoscope through the mouth into the duodenum, and from the duodenum we pass it to the to the CBD, and we remove the we can identify the stone here. In MRCP, we inject an IV contrast to the patient through an IV route and take an X-ray, and the X-ray provide a detailed anatomy, a detailed picture of the anatomy of the biliary tree. In LFTs, the bilirubin and the ALP will be raised, which are suggestive of obstructive jaundice. And what is the T-tube cholangiography? During surgery, the doctor places a T-tube in the T-tube is placed in the gallbladder. The long end of the T-tube is bring out and is anastomosed with the anterior wall of the abdomen. This T-tube basically drain the common bile duct, and we give a dye is injected through the T-tube, and an X-ray is then taken, and this X-ray is called T-tube cholangiography, and this T-tube cholangiography will show us any remaining stone, any obstruction in the and this T-tube cholangiography is basically show us obstruction in the common bile duct, because the level where there is obstruction, the dye will not pass from that level upward, and up to the from the obstruction onward, no dye, we will not appreciate any dye in the X-ray. We can do T-tube cholangiography. The treatment option are: first we will do minimal invasive surgery in which an endoscope will pass, and sphincterotomy or papillotomy will be done. That is, the endoscope will pass to the duodenum, and at the ampulla of Vater where the CBD opens in the duodenum, the sphincter will be cut. A hole will created to increase the opening of the CBD, and endoscope will pass through the CBD, and if the stone remain there, it will be removed by the endoscope using Dormia basket. And we can also remove the stone from the CBD by laparoscopic procedure, which is called cholecystectomy. In open surgery, we can explore the CBD. If there is stricture or ligation, we can correct that, as well as if there are stone, we can remove the stone and we will place a new tube to drain the area. The complication usually develop after cholecystectomy are if there is damage to the biliary tree, biliary leakage will occur, which will lead to biliary peritonitis, and biliary fistula can develop, and CBD is mistakenly ligated, as we have discussed. Damage to the hepatic artery can occur, which will cause bleeding and will cause hematoma. And if injury to the duodenum occur, duodenal injury can occur, as well as incisional hernia can develop, and the patient can develop infection, adhesion, and structure at the wound side. These are the common complications after cholecystectomy. So if you are liking my video, please subscribe my channel, and write about your feedback in the comment section, like my video so that I can make more video. Thank you.